Okay. Hello, my name is Megan Abbott, and I'm going to do the video assessment of the lungs, thorax, cardiovascular, abdominal, musculoskeletal, and the neurological exam. And this is Sue Gifford. We do have the authorization form filled out for this, and we're going to begin. So first off, hi, my name is Megan.
Hello.
I'll be your nurse practitioner today. We're going to go over checking your heart, lungs, abdomen, your muscles, and also your nerves, and make sure that you still have steady gait and all of that. Good. So let's get started. To start, I'm going to go on ahead and just look at her and watch her breathing, and make sure that when she is breathing, she's not using any accessory muscles or having any work of breathing, and that her respirations are equal and unlabored. There's not one side versus the other that is moving irregularly. And also, I'm going to look at the back, so I'm going to have you come to the side here. And with this, I'm going to also still be inspecting and looking to see that both sides are rising, of her chest are rising and falling equally. And also to do this, I'm going to be checking and placing my arms in, and as she takes a deep breath in, my thumb should move out equally to both sides, and she is breathing normally. And also with this, I'm going to be checking to see if there is any lumps or abnormalities, and then I'm going to percuss and just listen to see if there's any abnormal dull sounds in between the intercostal spaces that would possibly determine if there was any consolidation or anything like that. So we're just going to go on ahead and percuss. Okay, and then also, since she is in this position, I'm going to go on ahead and listen to the back of her lungs first, and then we'll move on to the front. So at first I'm going to listen to the top anterior, and whenever I place the stethoscope on your skin, I just want you to take a slow deep breath in and out.
Okay.
So we'll do a slow deep breath, and we're going to do it again. Now I'm just going to listen to the bottom lobe here. Deep breath in. And one last time. Okay, and while I'm also back here, I'm going to go on ahead and listen for bronchophony, and this would determine if I did hear any clear voice whenever she is saying 99, then it would determine if there was consolidation in that area. So I'm going to go on ahead, and whenever I put the stethoscope on your back, I want you to say 99 each time. So we'll start now.
99,
Okay.
99, 99, 99, 99, 99, 99, 99.
Okay, and during that, it did sound muffled throughout. There was no areas that were clear, and so that is actually a good thing. So we'll go on to the front. So I'm just going to listen to the front, and also during the normal exam, I would have them in a gown where I could physically see all areas as I was doing the exam. And so now we're going to listen to the front, and I'm going to do the same. I just want you to take a deep breath in and out. And then I'm going to listen to the side here. Deep breath in and out. And now the last thing I'm going to check for is CVA tenderness. So on this, I'm going to just check and hit the back and hit the back. And with that, if there was a CVA tenderness, we would be looking at possible kidney problems that might be causing some discomfort. So now we're on her lung exam. Her lungs were clear in all fields. She did not have any bronchopnea. She did not have any areas of dullness to percussion, and it was otherwise negative. So now we're going to move on to the heart, and for that I'm going to have her lie down at a 30-degree angle. And initially I just want to look, and I'll be normally looking at both sides, but initially I'm going to be looking at if she has any JVD or any abnormal elevated pulsations or anything like that in her neck, of her jugular veins, or in her carotid arteries. And also, while she is laying like this, I would be looking at the apex of her heart to see if there's any ventricular heaves or any abnormalities with that. And with her, I'm not seeing any abnormalities aside from just regular breathing pattern, and I'm not seeing any jugular distension. And so now I'm going to be checking her carotid arteries, and first I'm going to palpate, and then I will listen to see if there is any bruise or any abnormalities. So first I can just let you have your head straight ahead. There we go. And then on this, I normally will listen with both the diaphragm and the bell. So I'm just going to listen. I'm just going to listen to this side. Okay, and I do not hear any bruise or any different sounds in there. So now I'm going to go on to the heart, and for that initially I'm going to listen. I'm going to have you sit up first off on that, and I'm going to be listening to all four areas to check the aortic valve, pulmonic valve, tricuspid, and mitral. So initially, and I'm also going to use bell and diaphragm on each one of these valves. So I'm going to go second intercostal space. Okay, and that's the aortic. Now we're going to go over to the left side and also second intercostal space for the pulmonic. Okay, now I'm going to go down to the fourth. This is primarily listening to the tricuspid. And finally, I'm going to go down to the fifth intercostal space, midclavicular line, and primarily that'll be at the apex of the heart, but also to listen to the mitral valve. So on this, you can also have the patient just on women lift up their left breast so it would be easier. And then I'm going to listen one more time with the bell, and then I'm going to listen for the apical pulse for 1 full minute. Okay, and her heart rate is 67. And next I'm going to be just checking for her pulses to make sure they're strong bilaterally in all extremities. And so to start out, I'm just going to check for capillary refill on both sides. And hers is less than 2 seconds bilaterally. Okay, 2+ of the wrists. I can check those. Okay. And 2+ bilaterally. No. And now I'm just going to check the dorsalis pedis and also the posttibial pulses. And I'm also going to be checking for any edema. Okay.
Just ignore.
All right, now I'm going to have you lie back down. And I'm just going to check the popliteal pulses. Good. And last, the femoral pulses. Okay, and so on her cardiovascular exam, her heart rate is of normal rate and rhythm. It's a normal S2, S3. I did not hear any, S1, S2, sorry. I did not hear any S3, S4. I didn't hear any clicks, murmurs, or any sort of friction rubs. Also, her pulses are 2+ bilaterally of her upper extremities. Lower extremities, her pulses were 2+ and equal of the dorsalis pedis and popliteal and femoral. Her posttibials were bilaterally about 1+, and she does not have any edema. There's minimal non-pitting edema, possibly traced to her left lower extremity, but other than that, it's otherwise negative exam. So now we're going to move on to the abdomen, and for that, I'm just going to have her lay flat. And I'm going to take one pillow out from underneath.
Mm-hmm.
There we go. And for this, I'm going to initially inspect her abdomen and just make sure, noting any scars or surgical procedures. And in her case, she has had hemicolectomy and also colostomy in the past. So there is some scarring of midline lower abdomen, and also near her umbilicus. And so after looking at all that, I'm going to go on ahead, and I'm not noticing any abnormal pulsations or anything like that. And now I'm going to listen to her first and just check her bowel sounds and listen for her aortic artery, renal arteries, iliac, and also femoral. Now I'm listening for her aorta. And her iliac, now her renal. And last, her femoral artery here. Okay, and I'm not hearing any sort of bruise or anything to any of her aorta, iliac, renal, or her femoral arteries. So now I'm going to go on ahead and start with light palpation, and then we'll move on to deeper palpation. I'm going to try to palpate the spleen and also check the liver and the Murray sign. So we're going to initially start with light palpation, and right now I'm just feeling for any sort of abnormal masses or firm areas. And is this causing any pain at all? No?
No.
Okay, we're going to go a little bit firmer. And now with this, I'm going to also be checking to see if this causes any discomfort or pain anywhere. And when I get over to this side, I'm going to be checking to see if I can palpate her spleen. So right here, I'm going to have you take a deep breath in, and I'm going to have you release. Okay, and push in a little bit harder. And on her, I'm not feeling her spleen at all, which is, luckily, that's normal. And now I'm going to be checking for her her liver border. And so to do that, I'm going to initially push up. And now I'm going to have you take a deep breath in. And I'm going to hook underneath her rib here. And now release. And I can feel the very edge of her liver, but that's not causing any pain. Is that correct?
No.
And a person, if that did cause discomfort, that might be a sign of some gallbladder inflammation or anything like that in that area. And now I'm going to go on ahead and percuss and listen for any areas that sound dull. Normally in the abdomen, you're going to find it'll sound more tympanic because it's primarily full of air. If there is any solid areas, then that's something to check into. So we're going to percuss. And now I'm also going to percuss up towards where her liver is to find the edge of. Okay. All right. Now, I'm also going to check for any positive signs for appendicitis. So we're going to do the psoas sign. And to do that, what I'm going to have her do is I'm going to have you bend your knee a little bit, and I'm going to have you try to lift your leg up against my hand. So I'm going to have you push up. And if that had caused pain in her right lower quadrant, that could be indicative of appendicitis. And also we're going to check the obturator. And to do that, I'm going to lift her leg up, and I'm going to rotate it in. And if that caused discomfort too, whenever I did rotate it, it would indicate possible appendicitis also if that caused pain. So that concludes the abdomen, and on the abdominal assessment, she has had surgeries in the past of her abdomen. She has normal bowel sounds through all quadrants. I did not feel any masses. Her spleen was not palpable. Her liver is, it was not enlarged, and I did not hear any abnormalities. And she did not have any pain with any motion. And just of note, I mean, she does have her appendix out and her gallbladder, so, you know, we would not have expected any discomfort with that. So, moving on, we're going to go on ahead and start the musculoskeletal exam. And so for that, I'm just going to have you stand up for me. And initially on the musculoskeletal exam, I would normally be checking for symmetrical muscle tone, that all of her muscles look normal. She does not have any abnormally enlarged joints or any sort of deformities to any of her extremities. I would also check to see her posture. Is her back straight? Does she have any sort of curvature or abnormality to that? And so to begin this, you know, with her, she does have normal muscle tone. There's no areas of flaccidity or rigidity, so that you would see with other disorders. And I'm going to start off with range of motion of her neck. So first off, I want you to tilt your chin down and look up to the ceiling and go ear to shoulder, both sides. And you can just relax your shoulders there. And turn your head side to side. And also, does that cause any discomfort at all?
No.
No. Okay, so now I'm going to have you turn to the side for me, please. And I'm going to look at, and normally she would be in a gown where I could see if there's any abnormalities of her spine. And with that, I do want you to bend over to like you're touching the floor. And I just want you to do full range motion on your back. And you're looking for any abnormalities or curvature of the spine here. And you can stand on up. And now I'm going to be palpating to see if there's any abnormalities of your back. Is there anything that's causing pain?
No.
Okay, and I'll be checking all the way down, feeling for any masses or any changes that are different from one side to the other. And now I'm just going to have you turn around straight. And what I'm going to initially do is just kind of observe any range of motion. So first off, I'm going to be checking her shoulder, and I'm going to abduct, and then we're just going to do a rotation and see if there's any pain or abnormality there. And we're going to check your elbows, and we'll also be checking your wrists. And if I can have you just move your wrists around, you have no discomfort or anything with that. No. And you can flex and bend your fingers. And also, I want you to rotate, okay? And there's no problems or pain with that?
No.
We're going to go to the other side, and we're going to do the same thing. I just want to see your abduct. And we're going to just rotate around and see that she has full range of motion of her shoulder, and there's no pain at all or any crevice or any abnormalities in there. So we're going to have you bend, and then we're also going to have you twist to see that there's full range of motion of the elbows and hands and wrists, and there's no abnormalities there. Now, while you're still standing, I'm just going to go on ahead and check strength. So I'm going to have you try to lift up against my hand. Okay, and we're going to go down. Okay, and I'm going to do the other side. And I want you to push down. and we're gonna lift up, okay? And I want you to fan your hands out and go against me as I'm trying to push your fingers and everything in. Now I want you to put your hands in, and I want you to try to push out against my hands. Good, good. And she does have strength bilaterally. Her strength in all of her extremities are equal bilaterally. I did not feel any crepitus in her shoulder joints with rotation. And we're going to move on to the legs. So I'm going to have you, well, while you're standing, we can do part of the neuro too. We're just going to go on ahead and do the walk first.
I'm sorry.
No, that's fine. And turn around. And really, musculoskeletal and neuro can be a little bit combined. And with that, I'm also just going to do Romberg while you're standing. So I want you to turn your hands up and close your eyes and just try to stay straight to see if there's any swaying or balance issues. And you can open your eyes. That was negative. So now I'm going to have you have a seat right now. And what I'm initially going to do is check for strength of the lower extremities. So I'm going to have you push up against my hand. And I'm also going to have you pull back. Okay, and I'm going to have you do it again. And pull back. And now I'm going to have you push down against both my hands. And I'm also going to have you pull up and flex your feet. Flex your feet up. There you go. Good. And so the strength is equal bilaterally. And now I'm going to check range of motion of her hips and her knees and her ankles. So I'm going to have you lie on back down. Now, first I'm going to just check range of motion of her hips. So I'm going to have you bend your knee. And I'm going to check the internal. I'm going to have you stretch out. And are you having any pain throughout?
No.
No. And also on your knee, I'm just going to have you bend and I'm going to have you stretch out. And then also with this, I'm going to have you bend your leg again. With this, I'm just going to go on ahead and do the McMurray test. And so with that, what I'm going to do is I'm going to rotate and straighten her knee out to see if that causes any pain to indicate if there was any meniscal tear. And I'm also going to have you just rotate in and do that. Now with that, we're just seeing if there's any meniscal tears or anything like that, if we can rotate the knee and flex and straighten that. Now we're going to do it to the other side. It's not that easy in this position, but anyway, I'm going to check your hip first. So I'm going to bend your hip in. We're going to bend out. Okay. And full rotation. And also I'm going to check for any crepitus in your knee. So I'm going to feel up. And then I'm going to try the McMurray's test and check and see if there's any pain or anything that causes. Okay. And also I'm going to check your heel here. I'm just going to have you relax. And what I'm going to do is hold your Achilles here. And I'm checking to see if there is any pain or rigidity or anything in your ankles. And now I'm just going to flex your ankles and move your feet around and see if that causes any discomfort at all. And move your toes for me. Okay. I'm going to do the same over here. I'm just going to have you flex your foot. Good. And move your toes. Good. No discomfort here. So on the musculoskeletal exam, it was negative. She does not have any crepitus of her joints. She has full range of motion and full strength in all extremities. They are equal. And her skin is warm. She does not have any abnormal wounds or ulcerations or areas that look like she has any problems at all. And now we're going to finish up with the neuro exam. So on this one, I'm going to have you sit up for me. We already did the Romberg and your gait, and that was normal. Now we're going to move on to checking your reflexes. And just as a head note, I'm not completely wonderful at these, but first we're going to check the biceps. And for this, I'm just going to have you get really loose. And we're going to check. And on this, I want you just to relax your arm. Okay. We're going to check that. And that's checking the triceps. We'll go to the other side. I'm just going to have you relax. And now I'm going to have you relax your arm and do the triceps again. And we'll check that. Now we're going to check the patellar reflex. And for this, we're just going to go right below the patella, right into that area here. So I just want your legs relaxed. And now we'll check the other side. And then we're going to be hitting to the back of the Achilles, and I am not great at these, so just as a heads up. And check those. And one of our last tests is I'm going to be checking the sensation of our lower extremities. To do that, I'm going to be using the end of a cotton swab and then the hard end of the wooden end of the swab to determine if she feels something that is sharp or soft. So I'm going to have her close her eyes, and I'm going to just, after each one, she can tell me if she feels something that's sharp or soft. So,
soft, sharp, soft, 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 sharp, sharp, soft, sharp, sharp, soft, sharp.
okay. Now we'll go to the other side.
Soft, 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 sharp, soft, sharp, 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 soft, sharp, sharp, soft.
Okay. Now we'll go to the lower extremities. We'll go on ahead and do
Soft, sharp, sharp, soft, sharp, soft, sharp, soft, soft, sharp, sharp.
okay. And the last ones.
Soft, sharp, soft, soft, sharp, sharp, soft, soft, sharp, sharp, soft, sharp, soft, sharp.
Okay. And so on her neuro exam, she did have a negative Romberg. Her gait was steady and regular. There was no balance issues. Her reflexes were 2+ of her upper and lower extremities, and her sensation was equal in all extremities. So I believe this concludes our video assessment. Thank you.
Thank you.